Okay, good morning everyone. My name is Afiq. I'm a sport medicine MO currently rotating in Queen 2. So today I would like to talk about overuse injuries, specifically about tendinopathy. Alright, before we move on to tendinopathy, let's just zoom out on the cause of predisposing factor of overuse injury. Predisposing factor for overuse injuries includes intrinsic and also extrinsic. So intrinsic means there's a problem inside your body, such as your muscle is weak, there's muscle imbalance, there's a malalignment, and so if let's say there's a length discrepancy and there's a lack of flexibility. So while in extrinsic means that there's a problem with your such as shoes, the surfaces, environment, and equipment, and also including your psychology, nutrition as well. And the most important is a training errors whether it's excessive or faulty training method So overuse injuries can include multiple components such as bone, even chondral, and tendons and so muscle. But today I would like to talk about tendons specifically. So what is tendinopathy? So tendinopathy means is a general term for tendon pain. It includes tendinitis and so tendinosis. Okay. But in this tendinopathy, we're going to dive into a contemporary model of continuum of tendon pathology that was initially proposed by Jilko and also Craig Purdom back in 2009 So it has about 3 stages. First of all is reactive tendinopathy. So reactive tendinopathy can be meant by a non-inflammatory response to an acute tensile load to the tendon. Okay, what happened in cellular level is that our tendon, when we have a load, extra load, will become thickened instead of a normal adaptation, which is stiffening. So inside the cellular level, there's increase of glycoproteins, which is a repair protein, and also increase in the fluids in the extracellular matrix. All right. So, but the tenocyte number and nuclei is still same. Basically say that the tendon is trying to adapt to the overload Okay, but if let's say you didn't adjust the load accordingly, it will then move into the second stage, which is the tendon disrepair. So hence the name disrepair means try to repair but repair in the wrong way. Okay, so in this tendon disrepair stage is a worsening tendon pathology with a greater matrix breakdown. And also the tenocyte nuclei also become rounded instead of flat. So in a cellular level also there's an increase in protoglycans and also increase in collagen. So this increase in protoglycan, which is a repair protein, and also collagen will cause the matrix to disorganize. Also this will lead to what we call a neovascularization. Inside the tendon they will have a blood vessel there. Alright, so this however in stage 2 is still reversible to go back to reactive tendinopathy or back to a normal tendon if let's say we adjust the load. However, if let's say we didn't adjust the load, then it will move to the stage 3, which is the degenerative tendinopathy, and also what we call an end stage of a tendinopathy This is irreversible. So in cellular level, we can see that there is apoptosis and absence of tenocyte nuclei Alright, and also the matrix will be breakdown. There's disorder of collagen, and also there's increased neovascular formation. Alright, like I said, this stage is irreversible. Alright, so moving on, we have done at the stage of tendinopathy. Now we are moving on to the stage of rehabilitation for tendinopathies. So this was initially proposed by Miliaras back in 2015. Alright, it is important to diagnose the stages of the tendinopathies before we doing a rehabilitation. So this rehabilitation proposed of 4 stages of rehabilitation. First one is isometric exercise. It's an great exercise to reduce tendon pain. So basically this one is to reduce the muscle cortical inhibition so that the patient are able to do further stages more easily when the pain is reduced. Okay. So hence the name isometric stands for same metric distance. There is no movement between limbs and the muscle contraction. Alright. So next we move on to the isotonic exercise. Hence the name iso, same, tonic, load. Means there is a movement between the muscle but it's same load. Alright. So this one is start after the pain free or the pain is the patient can tolerate the pain. All right, this one aim to improve the muscle tendon unit strength. All right, so it is famous. We can focus on the eccentric in compared to the concentric strengthening lah. So in Milaras et al, it says that you can do like 3 seconds concentric and then followed by 4 seconds eccentric. So this stage can take about 12 weeks. So once stage 2 or we complete 12 weeks, then we can move out to energy storage exercise, which is a stage 3 lah. So if patients are able to tolerate isotonic exercise, we can proceed with energy storage exercise. So this stage is to store the energy in the tendon, a faster eccentric exercise and slow release concentric exercise. So we can do this at 2 to 3 times a week lah. So once stage 3 is settled, we can move out to the last one, is sport-specific energy storage and release exercises lah. So this one is once able to tolerate high energy storage load, we can replace the stage 3 lah. This one also we can do 2 to 3 times per week lah. Meaning to say, stage 4, we are safe to say the patient may able to go back, return to sports or return to work lah. Alright, I think that's all for today from my side lah. Alright, so don't forget to subscribe, comment and like.